Let's have a look at what we're going to do for today's class. So we're going to test your knowledge of medical and layman technology. Okay, terminology, not technology. Terminology. Okay, so this is really important because in listening part A, we're going to hear a patient speak. Okay, and they are unlikely to use super medical words. Right? They're more likely to use everyday language. And so we need to be able to go between these two types of language that we hear and also that we're going to see on our question paper, because the language on our question paper is going to be a bit more medical. We're going to look at the structure of listening part A for those of you who are new. We're going to look at strategies for completing part A. We're going to practice gap fill strategies because listening part A is, of course, a gap fill exercise. We're going to do an extract from the test, so we're going to do some listening, and then we're going to take a really close look at the transcript. Now, I want to point out why this is so important during your practice. So when you are practicing listening, or after you've done a listening exercise, it's always a good idea to look at the transcript. Or to look at subtitles if you're watching a video, for example, after you've listened initially. And the reason for this is because it helps you sort of match up what you heard or what you think you heard, maybe, with perhaps if you're doing a question, a practice test, then what's on the question paper. How can you match what you hear and what you see? If you're just doing a sort of general listening exercise where you're watching a video on YouTube, looking at a transcript or looking at the subtitles after you've listened can help you check that you've understood things correctly. So that's what we're going to do before we finish our class today. So I'm going to look at, Abdullah has two questions. One is, when should I book a tutorial? Okay, I'm just going to address these two questions before we move on. Abdullah, it depends on it depends on a lot of things. It depends on when you're doing your test. It depends on how much help you think you need in certain parts of the test. It depends on how much time you have. It depends on a variety of things. I would say, as general advice, book a tutorial when you feel like you need a bit of extra help with a certain part or parts of the test, that you're not sort of advancing, you're not quite sure what it is that is holding you back. If that's sort of my general advice to everybody, okay? Abdullah's other question was, is grammar important in the listening test? Grammar is important in terms of when you're listening, because you need to be able to understand what's being said, of course, and if your grammar is poor, it's going to be a lot more difficult to do so. Sorry, it wasn't Abdullah that asked the question, it was Ambati, apologies. But in terms of writing your answers for listening part A, we're going to have a look at that a little bit later on about what we need to include in each answer and what not to include in terms of grammar. And Ambati's other question is, are we scored individually in listening parts? Okay, I'm not sure what you mean by if you're scored individually, but essentially you need to get around about 30 out of 42, a minimum of 30 out of 42 usually, to get a B score in listening. So that's 42 total. You don't need to pass each part of the listening individually on its own. You just need to pass listening as a whole. Okay, so guys, try to keep your questions related to what we're doing at the time if you can, and then at the end I'll try and answer any other questions. Okay, so we can keep the class moving. Now, make sure you've got a piece of paper handy to write down any notes that you might have, but also to write down your answers during the listening exercise. During the listening exercise, please don't write your answers in the chat box, okay? So, We're going to do a quiz in a second, but first we're going to look at some vocabulary because, like I said before, we need to get comfortable going between what we call layman terminology, so that the language that patients are more likely to use, and medical terminology, right? So let's have a look at some phrasal verbs. Phrasal verbs are very common. Patients often use them when they're talking about how they're feeling, they're explaining their needs, their conditions, etc. So patch up, first of all, patch up. What might a patient be referring to if they're talking about patching up, patching something up? Write your answer in the chat box. Let's see what people have come up with. Okay, some of you are close. Let's have a look. Providing minor medical care for someone, minor medical care. Okay, so the example given here, after cutting my leg on a rock, paramedics quickly patched me up. Okay, so a lot of you are talking about the idea of a medical patch. Remember here we're talking like, you know, like a patch that you would place on something. That might be part of it, but that's not necessarily what we're talking about here. To patch someone up is it's a phrasal verb, and it's not a noun like a pat that you put perhaps over an eye or perhaps over a wound. We're talking about the idea, this phrasal verb that means providing minor medical care. Okay, often referring to something like a cut, right? Okay, lay up, or rather to be laid up. What might a patient be referring to here? Okay, not quite. Muhammad, in terms of the one before, you'd be talking about the person patched him up. Okay, all right, let's have a look. No one's quite there yet. To be laid up is to be forced to stay in bed due to an illness. He's been laid up with the flu for a few days now. I've been laid up in bed with a migraine. Okay, so to be laid up, I'm sort of incapacitated for, you know, temporarily because of an illness. Ooh. Okay. To take something up, to take something up. Okay, good. Some of you are quite close. Some of you are almost there. I missed the person that got it right. They just went past me. To take something up is to begin doing an activity. Okay, so for example, to start smoking. I took up smoking when I was 15 years old. You might also take up a hobby, as somebody said. I missed their name, but to take up a hobby. So I took up yoga a few months ago, and it's really helped with my stress levels. Okay, to take something up. Doesn't have to be exercise. It's more about just a general activity idea. To work something off. What might a patient be referring to here? Sandra, I hear what you're saying, but it's not quite the right way of expressing it. So Sandra's kind of getting there. No. Sandra was there we go. Sandra's got it. Okay. To burn calories by exercising. Okay, to burn calories by exercising. To work something off. I really need to work off the ice cream I've just eaten. Okay. Okay, and the next one, to bring something up. Now we're talking about in a medical context here. This can have a few different meanings, but Lily, your second one is better than the first. Estelle, this can be, it can be one meaning of this, but we're thinking about another way of another meaning rather than the one you just mentioned. Same with you, Sue-Ann. We're thinking about another meaning. Here we're talking about vomiting. I'd no sooner eaten lunch when I brought it back up again, right? So it's really important to remember that often phrasal verbs in English, depending on the context in which they're being used or why they're being used, they might have a few different meanings. So to bring something up, to bring my food up rather here, is when we're talking about vomiting. To bring something up might be, as a few people have said to me, to bring up a topic of concern, right? To perhaps the patient might walk in and say, look, doctor, I'm really worried about something. They're bringing something up, okay? They're bringing up a concern. So that's also a possibility. But here we're talking about vomiting. Now, I can see that for most of us, this was new, right? I can see that for most of us that these were new. So take note of these, and we're going to move on. You're going to need these later. Let's take a look at this one here. So now we're going to go the other way. So now we're going to look at medical terms and go into layman terminology. So you might write down abrasion in your case notes. What is a patient likely to say? They're probably not going to say abrasion. Abdullah, I don't think a patient would mention it like that. Sue-Ann, Rashid, okay. So there's a few of you getting closer. An area of skin that's been scraped away. I have a nasty looking scrape on my skin. Okay. So a scrape, an abrasion is kind of like a scrape. Okay. Yes. It's a sort of not a very deep skin injury, right? Deep skin abrasion. It can be a superficial cut. Yeah, okay, thank you, Victoria. All right, what about this one here? Prone. What might a patient say instead of saying prone? Not quite a win. Okay, good. Some of you are close there. You're all coming in so quickly today with your answers. I can barely see your names. Okay, so Mazartha's got it right there. Lying face down. That's how we would describe this. When they operate my back, I have to be lying face down on the operating table. So this is the idea of being prone, being face down. Abdul need to be a bit more specific there with position. Superficial. Okay, hang on. I'm just going to go back for 1 second here. I'm going to cover up superficial for a second. Sue-Ann has an idea here, to be prone to something. Okay, that's different. So if you say, so here we're talking about the position, the prone position, but if you use it in this way, to be prone to something, right? We're talking about this, you have a tendency to you're more likely to experience it, yeah? To be prone to infection, for example, or as Yawin said, that you're more likely to get infections, okay? Or, you know, your condition means you're likely to get infections. Yes, that's true. So, yeah, okay. So be aware of that, but here we're talking about the position, okay? All right. Superficial. What might a patient say? They probably wouldn't express it in that way. April Joy, yes, okay. On the skin, not too deep. Okay, so they're more likely to say something like it's near or on the surface of the skin. They might call it a minor cut, okay? I've got a minor cut. So yeah, you're all kind of close there. Just be careful with how natural what you're trying to say sounds. Now, I just want to point something out here, that some of you seem to sort of understand the general meaning of what's going on, but you're not sort of able to express it naturally in a different way. And this is really important. I know we're doing a listening class, but you need to know how these things would naturally be expressed in a different way. How would they naturally be paraphrased in layman terminology? So even though some of you kind of are close to the meaning in terms of what you're writing, you're not naturally expressing it. That's something we can help you with in tutorials and speaking intensives, trying to get those natural expressions right, okay? So topical, what might a patient say, or what's a definition of this? Not quite, Lily. Or, okay. Okay, so we're talking about here something that's applied on the outside of the body, on the skin. So, yeah, a topical cream is something that, it's cream that's only applied on the skin. And the last one, a sedative. Okay. We're all kind of around the sleep thing, relaxing, okay? It's a drug to calm a person or make them sleepy. It's this kind of idea. So the doctor gave me some medication to calm my nerves a little. So here the patient has rephrased the idea of a sedative as some medication to calm my nerves a little. Okay. Be careful, because we're talking about a sedative, it's a noun. We're not talking about, so for example, Abdullah and Montserrat, you're talking about verbs and adjectives here. To be sedated, for example, Abdullah is feeling drowsy, maybe would be a way a patient might explain this. Montserrat, to put somebody to sleep, would be to sedate. So they're all related words, but they're not a sedative as such, okay? The sedative is the drug itself. Okay, so I hope you took note of all those words, because now we're going to do a quiz. You'll see 5 sentences here, each with a blue phrase. I want you to replace the blue word or phrase with one of the words or phrases in the blue box at the bottom, okay? Remember that you may need to change the word form. I'm going to give you 1 minute to do that. Write your answers on a piece of paper, please. Okay, so number 1, we need to have the patient lying on his belly. We need to have the patient prone. Good. Okay, well done. Number 2, the man was in bed for weeks due to a fractured femur. The man was, be careful with your word form here, guys. The man was laid up. Laid up. So April, Joy, Madartha, and there was somebody else at the top there as well, Elizabeth. Good. Okay, good work. For those of you who wrote it in the present tense, remember, we're talking about he was in bed, so we're talking about the past. Okay. We really need to give her something to calm her down. We really need to give her a sedative. Okay, a sedative. Mrs. Jenkins just brought her dinner in room 9. Brought up her dinner, rather, in room 9. She just vomited her dinner. Yeah, in room 9. Okay, the cuts on the man's legs were only minor. The cuts on the man's legs were only Superficial. Good. Okay. Well done, guys. Well done. So I think most of us got those right. Now, if you're struggling with this, remember that it's really important to work on your vocabulary. Okay. Really important to work on your vocabulary for listening, because sometimes that is our underlying problem. Okay, if we're not familiar with the way things are expressed, naturally, we're not going to be able to do our listening effectively, right? It's going to be really difficult. So, Anne, it's a good question. The correct spelling is there on the screen for you. Okay, so let's get started with listening part A. So listening part A, what do we hear? So we get two different extracts. In particular, there are workplace consultations, okay? Now, what that means is you hear a patient speaking to a healthcare professional. You get 24 questions, so 12 per extract, and each audio lasts for about 4 to 5 minutes. What do you need to do? You need to comprehend. So that means understand, right? Understand what is going on from beginning to end. You need to interpret. Now, what interpret's referring to here is what we just did earlier. Being able to hear something and perhaps it's expressed differently on your question paper, but know that it means the same thing. You need to accurately record detailed information. So you need to write down exactly what you hear, okay? And this is usually where people ask about spelling. For those of you who have been here before and you know the answer, what are the rules about spelling? Do you have to spell everything perfectly to get the mark? No, what are the rules? Okay, so the meaning must be clear. That's what must be clear. The meaning must be clear. So you can't change the meaning by your spelling. Okay, and it must be recognizable. Oh, that's terrible spelling of recognizable there. Recognizable to the assessor. That's the correct word. These are the rules. So when you're later on, when you are when we do the exercise and you're evaluating your answers, think about this. Is the meaning clear if I'm not sure how to spell it? And would somebody else be able to recognize the word that I wrote? Okay. We need to complete a set of structured notes, okay, which we're going to look at in a moment. Now, we only hear the audio once. Why is that? Anybody in the chat box? I'll answer that in a second, Sue-Ann. Okay, so yeah, it's to mimic real life, right? If we're talking to a patient, we need to be able to understand what they're saying the first time, right? The most we can do is ask them to repeat or perhaps confirm what they're saying, but really we only hear things once. Okay, so I'm going to answer two important questions. Sue-Ann asked about capitalization. Capitalize matter in this part of the test, as long as you're sort of, try and be consistent in terms of, don't randomly include them, but you're not going to lose a mark if you incorrectly capitalize something. And Adiam, I think it is, sorry if I pronounce your name incorrectly, can we use synonyms? No, you have to write the word that you hear, okay? You have to write the word that you hear. I'm going to answer another question from Ahmed earlier. I think it's Ahmed. Ahmed asked me how to improve vocabulary. Ahmed, it comes from listening and reading. Essentially, you need to absorb as much as possible and make note of new words. Again, I highly recommend a package that includes tutorials because a teacher will be able to give you some more info about that, okay? And Ildiko, sorry. If you write plural, is it not correct? It depends on the word. Sometimes the plural can change the meaning, okay? Kinza says, what are the specific medicines used in OET listening? Kinza, I can't give you that information. They can talk about any medicines at all that is relevant. And Bharti, I already answered that question previously, okay? I did answer your question about grammar, okay? So the answer to that is essentially that it depends. We're going to have a look at that a little bit later on, okay? When we look at the answers. Adiam, if I miss a letter or not, is it correctly spelled? Adiam, I encourage you to refer to what I said before, which was remember that it needs to be recognizable, okay? It needs to be recognizable. Okay, so let's keep moving, guys. So this is what the task looks like. Essentially, you get subheadings with various lines in which you have gaps that need to be filled in with words that you hear from the audio, okay? Now, in particular, well, here you don't have any at the moment, but there will be lines that are already filled in, and they are really important. We're going to have a look at why they're so important in a moment. So in all the listening parts, pre-listening is extremely important. The time that you get before the audio part starts is really important. So what do we do in pre-listening for listening part A? In listening part A, we get 30 seconds and we need to study the notes carefully. We need to look at the headings to make sure that we know the topics that are going to come up. We're ready for those topics. We need to think about the types of words that might fit in each gap. Notice that it says type of word, okay? Not the word. So if number 13 says prescribed, how would I make it a prediction about the type of word here? Type of word. What kind of word is going to go after prescribed? It's going to be a noun. It's probably going to be a type of medication, right? It's going to be a type of medication and a noun. What if I said, what's wrong with predicting that it's going to be amoxicillin, sorry. Good, thank you, Sega. I could be wrong, right? If I go too specific, if I think, oh, it's going to be ibuprofen, it's going to be antibiotics, right? You might be wrong. You want to go general with your predictions. Good, Elisa, right? So it could be a noun. And if you go too specific with your predictions, as April, Joy, and Michaela just said, you're going to be listening out for this specific word that you predicted, and then you don't hear that word perhaps, and you get lost, and you lose your place, and you start to panic, and you miss the next 3 or 4 answers. So you need to go general with your predictions, okay? Nouns, verbs, adjectives, types. It might be a type of medication, a type of treatment, a type of symptom, etc. Okay? Okay, you need to think about the differences between spoken language and written language, or, for example, informal versus formal. The reason that this is important is because, as we said before, what you hear may not correspond exactly in terms of the words that you already have on your question paper. So it might be slightly different language that is used. However, in the gaps, you have to write the word that you hear, okay? And you also need to try and read all the information that you get. So that's all the headings and all the bullet points, okay? Mohammed just came in with a question, and he said that he seems to think that 30 seconds isn't enough time to do all of this. 30 seconds it seems longer than it is. And the other thing is that you need to be, I've said this before in other classes regarding listening, if you're struggling in the pre-listening time, you need to make sure that it's not your reading skills that are the problem. Okay? So it's really important that you make sure that you're not struggling to get through all the information in the pre-listing time because you're struggling to read, because that's a separate problem. So if you're struggling with all of this, think about that, Mohammed, and others there as well, okay? Okay, Adiem, I would discourage you from doing that. Okay, I'm going to explain why, okay? If it works for you, fine, but I would discourage that. Okay, so what do you get for on your question paper is what I meant to say. You get your patient's name at the beginning, then you get subheadings and also words and phrases that might signify time frames, okay? They're really important because numbers can take, can stand out in the text, okay? Technical vocabulary. So what might a patient say instead of a corneal abrasion? They're probably not going to say corneal abrasion, right? Sorry, not Paul, can you rephrase your question? I don't really understand it. Okay, so a cut in the eye. Okay, they might say scratch on my eye. Okay, something like that. Okay, what about here? Eye is, what prediction can we make here about number 14? Might be a condition, right? Might be a condition just because of the way that it's phrased and what comes after the gap needs to cover with hand. So it's something that's causing her to need to cover her eye with hand. Sagar, be careful, that is a very specific prediction. Victoria, same idea. Don't make two predictions that are too specific, okay? What about grammar clues? So, and Bharti, you asked me about grammar before. Grammar is important here because we need to be aware of grammar clues, right? We see that it's number 15 is preceded by to, which means that it's probably going to be a verb, okay? It's probably going to be a verb. Now, it's important to try and read all the lines in the on your question paper, not just the ones with the gap. And the reason for this is because the other lines that are already complete, like the ones I'm signaling now, they help us keep up, right? They help us keep up, okay? They help us keep up. So it's really important that we're taking note of all of these things and as much as we can, because otherwise we may get lost. Mohammed, don't worry about that. Sometimes you'll be able to see others' questions and sometimes you won't. It depends on when I turn that function on or off, okay? But if it's an important question, I will read it out for everybody if you can't see it, okay? All right, so let's practice this, okay? Let's practice this. So I'm going to give you 30 seconds to make those predictions. Read through all of the notes, make sure that you're making general predictions and get a good idea of what is going on here, okay? What kind of context are we in? Okay, your 30 seconds starts now. Okay, so let's have a look. We're going to make predictions about a couple of different lines before we do the listing. So let's look at number 17. What kind of, what type of word is likely to go in there? A noun, yeah? Again, Sega, be careful with your predictions. We need to be, it could be glasses, maybe it's contact lenses. We don't know, so it's better to say a noun, right? Better to say noun here. This is a good example, okay? Number 20. What's likely to go here? What type of word? Type of word. Not the word, a type of word. A noun. Thank you. I don't know who said it there before. A noun, and it's likely, Sandra says, it's likely to be a condition, okay? Develops something. Okay, good, guys. They're the kinds of predictions we need to make. Keep it general. Keep it nice and kind of loose is the word I'm looking for, okay? So remember that you will see this on your page, but sometimes the exact same words are going to be used. So you can see left eye, tears, but on other occasions they're going to use paraphrasing, right? They're going to use paraphrasing. And I can't remember who it was before because the chat box has been very active today, but someone asked me before about why they need to be worried about the type of language that they're going to hear in terms of informality and paraphrasing. The reason for this is because we need to make sure that we are familiar with the different ways that things are expressed. And you can see here, corneal abrasion is a much more formal medical way of saying a scratch, okay? 2-year-old son, my little boy, has begun to, starting to. So you can see there, this is why we need to be aware of these differences in language and different ways of expressing the same idea. Adian, wait for the end and I will give you an example of how to answer exactly. Okay, so a couple of tips. Remember, you have about 15 to 20 seconds of speaking before the first question is answered. Take that time to give yourself a purpose for listening. Remember that you need to try and understand the whole consultation from beginning to end. Use the headings and the bullet points to follow along. Make sure you're using all of the information you have on your question paper to follow along, okay? Don't just focus on the lines that have the gaps, okay? And remember that the answers come from the patient, but signposts, so the change in topic, sometimes come from the doctor, okay? It's sometimes the doctor that will move on to another idea. Okay, so this is just a quick reminder about the promotion that I mentioned earlier for those of you who have missed it. We are offering $12 US off just until tomorrow, guys, to everybody to celebrate International Day of Nurses today, okay? Because you guys are our heroes, especially right now. So use the code HERO12 to get that discount and get a package that gives you everything you need. Okay, let's do some listening, guys. Please write your answers on a piece of paper for the moment. One second.
So, Sarah, the nurse has just informed me that you're here with a scratch on your left eye. Is that correct?
Yes, it's quite painful.
Have you taken any pain relief for it?
Not yet.
Okay. While I'm having a look, can you tell me how this happened?
Well, it was my little boy's fingernail, actually. We have a 2-year-old, and I was in the park trying to put his coat on. It happened when he pushed his hand through the sleeve. It's my fault, really, because I should have trimmed them days ago, but every time I try, he rolls his hands into a fist and refuses to let me near them.
He's definitely scratched it. It looks to me to be a minor abrasion, which is good news. I'll be able to give you some lubricating drops to keep it moist and comfortable while it heals.
Are you sure, Doctor? It feels like there's something in there. My vision is different somehow, and my eye seems to be really sensitive to light now. I had to cover it with my hand. Also, while I was in the waiting room, I noticed that it was starting to twitch, like it was trying to get something out. And now, as you can see, the tears are just pouring out.
It may feel larger than it actually is, and the symptoms you describe are quite common, even for the most superficial abrasion.
Because a similar thing happened to a friend of mine. It wasn't from her child. I think she was gardening and somehow scratched her eye. She ended up getting an ulcer. I definitely don't want something like that. And that's really worrying because she ended up losing some of her sight. It's been troubling her ever since.
Let me assure you, complications such as the one your friend experienced typically only occur when a very deep abrasion is left untreated. Do you have any history of eyesight impairment?
The funny thing is, I'm nearsighted, so I've been wearing glasses my entire adult life. I'd have had them on today, actually, if I hadn't left them at home on the coffee table. Sometimes I even wear those coloured contact lenses because, as you can probably tell, I have one green eye and one's a greyish blue. I feel a bit juvenile wearing them, but maybe if I'd been wearing those today, I'd have had at least some protection. I've been with the same optometrist for 6 years now, and I go for 6 monthly checkups.
Okay. Well, I'll prescribe you some antibiotic eye drops just to ward off any infection while your eye's on the mend. Do you have any allergies or illnesses I should know about?
I know I'm definitely allergic to penicillin and amoxicillin because the last time I had either, I broke out in a terrible case of hives all over my body. It lasted for hours. I didn't have any other symptoms, but the doctors told me to avoid anything in the penicillin family. Also, when I was 22, I went to hospital just for a gastroscopy, nothing serious. And they found that I have an allergy to latex. Their gloves caused a red rash and even some blisters around my neck.
Any medication?
Not at the moment. I was taking something for sciatica, but I haven't had any pain for a while.
Will you be needing a certificate for work?
I'm a full-time homemaker, so no certificates needed for that. The one thing I guess I'll have to hold back from, though, is my aqua aerobics class every Wednesday. Will I have to stay away from the pool, Doctor?
I'd recommend it until your eyes had a chance to fully heal, at least. Now, before I give you any other...
Okay. Whoops. Hang on. I'm going to give you a second to check your answers. Okay. Check your answers. Make sure you're happy with them. And now we're going to move on to the next slide, which has some answers written, but they're all wrong. Okay, they're all wrong. So we're going to correct them. So number 13, caused by finger. Is that right? Okay, caused by finger, nail, fingernail. If you have a gap between finger and nail, that would be fine. Anything else, probably not. Okay. Number 14, sensitive. Is that right? Are you sensitive? Sensitive to light. Okay, sensitive to light. Number 15, twitching. Eye has begun to twitching. To twitch. Okay, so here, Mbati, can you see why our grammar is important here? We need to make sure we get the right word form here, right? Because if we wrote to twitching, that's not quite right. Number 16, possibility of developing ulcerated. An ulcer. Now, if you just wrote ulcer without the an, that would be acceptable too, okay? The an is not a compulsory. We're going to have a look at why that is on the next slide. Usually wears glass. Glasses. Okay, so for those of you who asked me before about whether or not plurals matter, here is an example where the plural does actually matter, right? Because if you wrote glass, it's a different word. So here, the plural does matter. Occasionally wears contact lenses. Occasionally wears, what's wrong with this? We're missing the colored. We're missing the colored. If you wrote it without the U, that's also fine. That's just the American spelling. Number 19, has regular checks. Checkups. If you wrote it without the hyphen, that's also fine. Number 20, develops allergy. Develops hives. Okay, so she actually said this word and we need to write down hives, even though hives perhaps are an indicator of allergy. What she said was hives. She didn't Number 21. So latex develops rash and red rash develops blisters. Okay, develops blisters. Number 22. Occasional bouts of back pain, occasional bouts of... This is a tricky one to spell, sciatica. If it was anything that looks anything like this at all or looks vaguely like the word, then you would get it right, okay? Number 23, occupation. Homemaker. If you wrote it as two separate words, that's also fine. And number 24, participates in aerobics lessons. Participates in aqua aerobics. Okay, aqua aerobics. So let's have a look. These are the words that are acceptable. The answers you see on this page are the acceptable answers, or anything that you know, would be recognizable. The words that are in parentheses are optional, guys. They're optional. Okay, they are optional. So what does that mean that they're optional? It means that if you don't write them in, that's fine. If you do, great. Okay. All right. Now don't go anywhere. Oh, 12 out of 12. Congratulations, Annalisa. Ahmed, I already answered that question. Please go back to the recording of the class if you need to have a look at it again. May, I'm not sure what that question means. Unfortunately, can you rephrase it? Okay, so let's have a look. That's fine, May. Okay, great. So now we're going to have a look before we finish. We're going to have a look at we're going to have a look at the whole transcript again, okay? But what we're going to do is match up the language, okay? Match up the language. So thank you, Elisa. So what I mean by that is we're going to take a look at what is on our page, okay, and what is in the audio, and how we can use what's in the audio to help us, okay, and how we can use what's on our page to help us, instead of making these things super confusing and super overwhelming, okay? So that's what we're going to do. So let's have a look. I'm just going to answer a question that came in from Ildiko, who you guys can't see. Ildiko says, I wants to know what I meant by optional in the previous slides. No, you don't get extra points for those, including them. You just need the words that are outside of the brackets for the point. You don't get extra points for extra words or anything. Abdullah, if you'd like to get me to get in contact with you, just pop your email address in the chat box, okay? All right, so I'm going to go through now the transcript. Gosh, I'm struggling to get my words out today, guys. I'm going to go through the transcript slowly. Please don't go away. This is a really important part of the class, okay? So let's have a look at each one.
So, Sarah, the nurse has just informed me that you're here with a scratch on your left eye. Is that correct?
Yes, it's quite painful.
Have you taken any pain relief for it?
Not yet.
Okay. While I'm having a look, can you tell me how this happened?
Well, it was my little boy's fingernail, actually. We have a 2-year-old, and I was in the park trying to put his coat on. It happened when he pushed his hand through the sleeve. It's my fault, really, because I should have trimmed them days ago, but every time I try, he rolls his hands into a fist and refuses to let me near them.
He's definitely scratched it. It looks to me to be a minor abrasion, which is good news. I'll be able to give you some lubricating drops to keep it moist and comfortable while it heals.
Are you sure, Doctor? It feels like there's something in there.
Okay, I'm just going to stop it there for a second. We're going to take a closer look at the language. So, 1 second, guys. My mouse has stopped working. Okay, there we go. So, let's have a look. So here we see she mentioned, well, the doctor starts off by asking the questions, right? But he says you have a scratch on your left eye, so that's links up with corneal abrasion. So we know that we're going to start hearing the answers soon. Then the doctor asks how this happened. Can you tell me how this happened? That links up to caused by on our question paper. So you can see why language is so important and being able to go between these different types of language, okay? So then she gives us our first answer, of course. She goes on to explain them a little bit more about what happened, and the doctor gives this explanation of the fact that, yes, it's definitely scratched, okay? And then he gives her some treatment options, but she's not quite sure about that. And she says it feels like there's something in there. This signifies two things to us. It signifies that we're going to start talking about her symptoms. So in this case, it's the patient who has provided the signpost information, not the doctor. And then she's also given us this here, foreign body sensation. So you can see foreign body sensation is super formal, super kind of medical compared to what she said, which is it feels like there's something in there. Very layman, okay? Very layman. So let's keep going and keep matching these ideas up.
My vision is different somehow, and my eye seems to be really sensitive to light now. I had to cover it with my hand. Also, while I was in the waiting room, I noticed that it was starting to twitch, like it was trying to get something out. And now, as you can see, the tears are just pouring out.
It may feel larger than it actually is, and the symptoms you describe are quite common, even for the most superficial abrasion.
Because a similar thing happened to a friend of mine. It wasn't from her child. I think she was gardening and somehow scratched her eye. She ended up getting an ulcer. I definitely don't want something like that. And that's really worrying because she ended up losing some of her sight. It's been troubling her ever since.
Look at this next part. So she gives a lot of information here, and we need to be ready to know where the information we need to write down comes from. So after she started talking about the fact that it feels like something in there, so we're at foreign body sensation, and she says our vision is different somehow. My eye seems to be really sensitive to light, and she directly says after this, I had to cover it with my hand, which is what we see here on our question paper. So we can see here the same language, or at least extremely similar language, has been used. Then she says this, I was in the waiting room, began in waiting room. Now, this is a good example of why we need to read what comes after the gap, right? Because hearing the word waiting room signifies to us that we're at question 15, okay? And then we, of course, get the next answer. It begins to twitch. Now, how do we know we're going to talk about patient concerns? Because that's our next topic. It doesn't really get signified by the doctor, except by the fact that he kind of says it may feel larger than it actually is, which indicates to us that he's sort of, he's addressing concerns, okay? But then she goes on to expand on this, right? And she talks about her friend, and what she's particularly worried about is this idea of getting an ulcer. And she goes on to expand about that, by saying she ended up, her friend ended up losing some of her sight, which corresponds to vision loss. So you can see why the lines that are already filled in, the ones that don't have a gap, they're very important. They help us keep up, right? They help us keep up. So make sure you're not ignoring them, okay? So the doctor is going to say now, in a second. We haven't heard it, but he's going to say, do you have any history of eyesight impairment? This is an example of where the doctor is giving the signpost information, and we're going to move on to the next topic.
Let me assure you, complications such as the one your friend experienced typically only occur when a very deep abrasion is left untreated. Do you have any history of eyesight impairment?
The funny thing is, I'm nearsighted, so I've been wearing glasses my entire adult life. I'd have had them on today, actually, if I hadn't left them at home on the coffee table. Sometimes I even wear those coloured contact lenses because, as you can probably tell, I have one green eye and one's a greyish blue. I feel a bit juvenile wearing them, but maybe if I'd been wearing those today, I'd have had at least some protection. I've been with the same optometrist for 6 years now, and I go for 6 monthly checkups.
Okay, so our next one. There's a lot of information here. Okay, a lot of information is given here. What is the paraphrasing or the synonym she uses, the patient uses for myopia? Can anyone see it? Nearsighted, right? So nearsighted. And then she goes on to say, I've been wearing glasses my entire adult life. So this corresponds with this idea of usually and since adolescence, right? Usually and since adolescence. And then occasionally wears contact lenses. Sometimes she wears contact lenses. Sometimes, occasionally. So there's our next answer, right? And how do we know she has regular checkups? She says she goes for 6 monthly checkups, and every 6 months, again, important to read what comes after the gap when you're preparing. 6 monthly, every 6 months, it's covered by that. So we know that the answer to number 19 is indeed checkups. Okay, let's keep going.
Okay, well, I'll prescribe you some antibiotic eye drops just to ward off any infection while your eye's on the mend. Do you have any allergies or illnesses I should know about?
I know I'm definitely allergic to penicillin and amoxicillin because the last time I had either, I broke out in a terrible case of hives all over my body. It lasted for hours. I didn't have any other symptoms, but the doctors told me to avoid anything in the penicillin family. Also, when I was 22, I went to hospital just for a gastroscopy, nothing serious. And they found that I have an allergy to latex. Their gloves caused a red rash and even some blisters around my neck.
Any medication?
Okay, so
not at the moment.
Here. The doctor specifically asked about allergies or illnesses, which means we're going to move on to our next topic. Again, the doctor's providing the signpost information. She mentions penicillin and amoxicillin. Now, this is important because the names of medications, if they're already written on our question paper, they stand out to us in audio. So take note of those if you see them on the question paper, because you'll be able to hear them clearly. And you'll know where you are, right? And then she mentions that she got hives. Broke out in is, again, a synonym for this idea, a paraphrasing of this idea of develops. And then latex, another word that stands out to us in the audio, you can hear it clearly, and it's on our question paper. So we know once we hear latex that we're at question 21, and we hear that she gets blisters. The doctor signifies the next topic, any medication, which corresponds kind of to this idea of background, okay? And she's going to finish up here with the last few answers.
I was taking something for sciatica, but I haven't had any pain for a while.
Will you be needing a certificate for work?
I'm a full-time homemaker, so no certificates needed for that. The one thing I guess I'll have to hold back from, though, is my aqua aerobics class every Wednesday. Will I have to stay away from the pool, Doctor?
I'd recommend it until your eyes had a chance to fully heal, at least.
So then occasional bouts of sciatica, occasional bouts, I haven't had any pain for a while. I was taking something for sciatica, right? And then I incorporates this idea of occasional bouts and it being medicated. Occupation that we see on our question paper is we know we're going to talk about this because the doctor asks about work, and then she says she's a homemaker, a full-time homemaker. Full-time is also written on our question paper. And then participates in aqua aerobics weekly. Well, it says here she goes every Wednesday, so that covers the weekly. Yeah. And aqua aerobics lessons, aqua aerobics class, okay? So hopefully that's shown you this idea of how important our vocabulary is here, okay? And how important it is for us to be able to recognize these different ways of expressing the same ideas, but that the language that we see here on our question paper can help us. It shouldn't overwhelm us, okay? So remember that the patient usually provides the answers, okay? 99.9999999% of the time. Use the headings and the bullet points to keep up. Use all of them. Hopefully what we did on that previous slide shows you how all of the headings, all of the bullet points can help us keep up, not just the lines with the gaps in them. Try to write down exactly what you hear as best you can, but if you do miss an answer, just keep going. Don't panic, move on, keep up with the text. Remember that at the end of listening part C, you get 2 minutes to quickly guess any answer or any questions that you miss. You need to go back and check all of your answers for listening parts A, B, and C in those 2 minutes and make sure you're happy with all of them. Okay, so we're just going to do a quick exercise before we finish. So number 1, 2, 3, 4, 5 here on this page, they are gap fill exercises. I'm going to play the sentences. They're from the audio we just heard, and I want you to fill in the gap. Okay, and this is what we're doing, okay, in listening part A. We're listening for specific words and details and trying to write them down. Okay, so let's do this. Number 1.
1. I was in the park trying to put his coat on.
2.
I'll be able to give you some lubricating drops to keep it moist.
3.
I'm nearsighted, so I've been wearing glasses my entire adult life.
4.
I have one green eye and one's a greyish blue.
5.
I've been with the same optometrist for 6 years now.
Okay, so number 1, I was in the what? In the park, right? In the park. Number 2, I'll be able to give you some what to keep it moist? What kind of drops? Lubricating. Number 3, I'm something, so I've been wearing glasses my entire adult life. I'm nearsighted. I have one green eye and one's a what kind of blue? A grayish blue. If you wrote it with an A, that's also fine. I've been with the same what for 6 years now? Optometrist. Good. Well done, guys.